Performance Medicine on our Tuesday night winter lecture series. Tonight we're going to be talking about a couple new things we've purchased here at Performance Medicine. One is called Ultherapy and one is a new laser. So we're doing a lot of new cool stuff. This is Kelly, my daughter, who's a board certified esthetician, has a lot of experience, has a great eye for artistry, and she's going to tell you tonight about how these machines work and what they're great for. We've done several already and we're getting some good results already, so I think it's been a good thing. So Kelly, take off.
Yeah, okay. So first I'm going to talk about the laser that we have. It's got a bunch of different things it can do. It can do, well, I'm just going to start with the slides over here. Well, I'm going to actually first start out with why skin care and your skin regimen is important. So every skin type is different, as you know, so everybody has different needs, so that's the reason why. And great skin takes a while to, get there, okay? You can't just have it overnight. So that's another reason why skincare, very important. Preventing is easier than correcting. So if you have serums to prevent any kind of sun damage or, discoloration, that's a great thing for you. Saves you money in the long run. When you look good, you feel good, obviously. And it can help you establish other healthy habits, like working out every day. So you should be on a daily skincare regimen. Every day. It's just very important. So that, along with what we're doing as far as lasers and Ultherapy, is just going to make the results better. You can't just have one without the other. Here we go. What do lasers do? What does our laser do? Skin resurfacing, tattoo removal, vascular reduction, which is the tiniest little spider veins you can have in your legs, or you can have around your nose area. That's pretty much where it appears first. Hair removal, acne treatment, and pigmented lesions. So it can do a lot of different things just with this one device. And I guess you can kind of pinpoint what you need the most. Everybody could use hair removal, in my opinion, in certain areas. And skin resurfacing, tightening is always a great thing as well. Okay, the Erbium YAG. So this laser piece to this device is going to give you the most, or the deepest treatment. It's going to get down in there, resurface that tissue that becomes fine, leathery. If you've got a lot of fine lines and wrinkles, this is a good thing for you to get done. It builds collagen. You're gonna have some downtime with it. You're looking at like 4 or 5 days, not being able to go out and do your normal things because you can't wear makeup if you're a woman. But it is a great thing to do, especially in the wintertime. But for that crepey, thin skin, it is an awesome thing to do. And what I can also do is outline like the tiny lines in your face with it, so it really gets in those lines and builds that collagen in there and sloughs off all that deadness. Here's some examples of what it does. You can see it's going to brighten, tighten, help with any kind of discoloration too. But it is a deeper, goes deeper. So you're going to have a little bit more downtime than you would if you just got a regular IPL photofacial. Hair removal. So you're a great candidate if you've got lighter skin and you've got darker hair. So laser underneath, your armpits is good. The great thing about this is you can shave right before you come in and then get it done, shave right after, whatever. You just can't pluck or wax 2 weeks before. So this is a great thing to get done in the wintertime, especially because you're not, getting out in the sun, or if you're not going on vacation, it's a good thing to get done at that time. Typically the treatments are gonna take like 6 times, around 4 to 6 for up here, and then 6 to 8 from here down here. Just kind of depending on your skin type and whatnot. But it is a great thing. For peach fuzz, I would recommend dermaplaning. That's also a thing I do here. It just gets that fine hair off of your face, and it's gonna help rejuvenate the skin and remove unwanted hair. But typically the laser is for dark hair. If you don't have dark hair, it's not gonna pick it up, because that's what it's attracted to. So, and before treatment, you wanna make sure you're not on any antibiotics, and you don't have a spray tan at least 2 weeks before. But you can get one right afterwards, whatever. Okay, the IPL, also known as photofacial. It targets pigment issues, brown spots, sun damage, red spots, rosacea, those little cherry angiomas. It's gonna get those off within like 3 treatments. For broken veins, capillaries on your face, some on your legs. Does not hurt. I've had it done. And typically with the veins in your legs, how many treatments is it, Dad, for legs?
Sometimes one treatment.
I think, yeah, it just depends, but most likely for that, just 1 treatment, so.
Sometimes we combine it with sclerotherapy.
Yeah, it's not for ropey veins.
For the deeper veins,
But it's gonna help prevent, if you have tiny little veins somewhere now, I mean, they're just gonna spread, so it's good to stop them dead in their tracks. Okay, so any questions about lasers, IPL, photofacial, erbium? What to expect? Okay.
How painful is it?
Well,
Hair removal, how painful is it?
okay, well, I mean, depending on your pain tolerance, it feels like someone's just kind of flicking you with a rubber band. It's not painful, it's not comfortable, but it's not extremely painful. Definitely doable. So.
How many hair removal sessions do you need to have?
So from like here down, 6 to 8 treatments. From here up, 4 to 6. Ready for
How
chin
long does
area?
it last?
So it's not permanent. Good question. It's not permanent, but it does reduce the hair. It's not going to grow back as thick. So you need to have these treatments done every 4 to 6 weeks, or it's not going to pick up that regrowth. But you'll tell a difference after one. With shaving, the hair follicle will just feel thinner. You won't have that stubble immediately afterwards. So, yeah. Okay, we're going to move on to the Ultherapy machine. And I have someone I've recently done it on. Dad, if you want to talk about how the pain wise and
Yeah, she did it on me a couple weeks ago, and it's definitely some heat, but certainly tolerable. Sometimes we tell you to take a Motrin before you come. I had a pretty easy time with it, really. I mean, it takes a while to do, but it's kind of a unique 3 months before it, and maybe even longer than that, before it really builds all that collagen up. But it's more for structure, whereas we use facial fillers for cheeks and things. But it's great from the top of your face all the way down to your neck and décolletage. But yeah, it's certainly tolerable. We have ways of making it a little easier on you, but everybody that's done it's been very pleased with it. It's a very unique treatment, for sure.
Okay, so Ultherapy is the only FDA-cleared device to actually lift the skin tissue and tighten. It is great for if you have some gel issues right here underneath your chin, if you want to get that tightened. It is typically just one treatment, which is awesome. You have to do multiple, but it's going to do things that filler can't do, because filler is going to fill you right here and give you cheekbones, but this is actually going to take that skin and lift it and tighten it. There's no downtime whatsoever. You could go and do your normal activities, put makeup on right afterwards. So it is an awesome option for people who don't, want to get a facelift or surgery. You don't have to go to the knife to do this, but it's going to gradually lift and tighten, which we all want and need. It's not a facelift, but it has similar outcomes as far as that lifting I was talking about. So this kind of shows like different depths that different devices go at. Lasers, you've got the radio frequency, the microfocus ultrasound, and then the actual surgical facelift on the very left. So this is going to target those deep, it's going to go all the way down to where a facelift would and lift it without having to be cut open. So as far as price wise, it's a lot better option. Downtime, all the above. So it just targets right above that muscle, and it's going to lift and tighten. Look at her. She looks great. What can I say? Yeah. As you get older, you don't want to look like you're overfilled. You don't want that, crazy lion look. And a lot of people these days get way too much filler, injections. This is a natural alternative to getting all that work done. Okay, this just kind of tells how, it does. It's just like ultrasound during pregnancy. We can see right beneath the surface of the skin where, your collagen is depleted. If you have facial filler, we can even see where that is in the skin, and we would just avoid those areas. We don't go right here. It wouldn't be used for anywhere right here or right here, above the thyroid or anything. It's right here, and we can take the skin, lift it, move it over, and then it does, the same thing as doing right here, but we just can't go over those areas. But it's good that we can visualize it, because we can see where we're going, what needs to be lifted, and where to stay away from. We can see bone on here, and your tissue, which is really cool. Okay. So, depending on like the depth of your treatment, we'll be able to see that by, how deep or how thick your dermis is. So if you've been using good skincare and, getting regular, treatments like hydrofacial, a dermaplane with a peel, chemical peels, microderms, you're gonna have that thicker tissue than someone that hasn't had anything done yet. So it'll be able to tell how thick that is and how deep we need to go. So that's kind of the lifting part of it. So like I said, this is not an immediate thing. You're gonna be able to see a difference. I mean, I can tell a difference, the people that I've done after like a week, 2 weeks, you'll be able to tell a difference every day, honestly, is what I've heard. So it's not like you go under the knife and you're, you have all like gauze all over you for months or however much downtime it is. It's just that gradual lift. So it's awesome that every day you're gonna kind of see something different happen to your face. So that laxity is really gonna tighten up. So the face and the neck, that's indicated for this area. You can do a brow treatment, which is gonna be like right around your brow area. It's gonna lift, and it pairs well with Botox. Actually, this pairs well with filler too, because you get your filler along your cheek area, and we don't target this area right here. We do underneath and above. So it's gonna build collagen underneath the eye area, which is good for places like us who don't do tear trough injections, because it's pretty dangerous. So it's gonna actually build collagen right underneath that eye area, those pads, and then right along that jawline. So also, if you don't want to get jawline injections, which you know, a lot of people do, it's really popular right now, this is a great way to, you know, it's a more natural option for you. So, any questions about, also, like I said, the neck, we avoid, you know, this region, but I really like it for this area, right along here. It's just a really good option for lifting, because most people have this problem, everybody wants this lifted. I mean, no one says, I want huge cheeks right here, you know, I wanna look like a lion, freak, you know, they just wanna be lifted, they wanna look natural.
Kelly, how long does a treatment, I mean, for you to do a treatment, how long does it take? Is it like an hour or a couple hours?
Depending on what region I do, if I do like the full face, it's gonna take like two hours, hour and a half, 2 hours. If it's just, you know, like right along here, an hour. Neck is low as 30 minutes, depending on what region. So everybody doesn't get everything done at once. You can like kind of pick different things. But from like 30 minutes for up to like an hour and a half, 2 hours.
Thank you.
Is it supposed to be just one, like, do you just do one area? Let's just say I only want my neck.
Mm-hmm.
You can just do your neck, and in one treatment it's done?
Mm-hmm.
Okay.
Yep.
So you don't have to keep coming back?
No, I want you back in 3 months, and we'll, you know, take pictures and we'll decide where you're at. Some people need more lifting than others, but yeah, it is one treatment.
My question was, I think I see through that, right? The eye hooding.
Mm-hmm.
So is that part of the treatment from here up?
Mm-hmm.
And so it's kind of broken down into, say, if you wanted the all over or neck area, you would kind of break that into 3 visits. You wouldn't do all of that at one time.
Right.
Okay.
And it's easier for you too, more comfortable. Yeah, so this would be like a brow lift, which looks awesome.
Mm-hmm.
We've done some people and it helps with like underneath eye, and yes, the eye hooding, it does lift if you don't have a blepharoplasty.
Mm-hmm.
So.
We have someone watching on Facebook Live that says, how does this compare to Kybella?
So Kybella is targeting fat, and this is targeting laxity. So they pair well together. If you've got, you know, fatty areas right along here, Kybella would be a good option, and then you know, follow along with this. But how's it different?
It says, how does it compare?
So if someone comes in and they're wanting to lose like 20 pounds, but they want this area taken care of, they've got just their fat just kind of lingers right here, Kybella would be good for that. But then once they lose that fat, they're gonna have some hanging skin, most likely, if they're not younger. So this would be more of a lifting, whereas Kybella is more of like an injection targeting that, you know, fat right there. So like I said, they pair really well together. And you can go all the way down to the neck. Kybella is just, you know, right here. So here's just kind of some examples of, you know, 120 days, 450, and then 70. So you're gonna see a difference, you know, with each week passing. So under the chin area, this is my favorite. You can just tell that it's lifting around that jaw area, and it's just smoothing out, and just kind of tightening around that and defining that jaw. The lower right is a really good, you can see that really clearly, just, you know, a jaw contouring. If you do too many fillers and you inject right around here, it's gonna actually make you look less feminine. This is a great way to show your jawline without being just overfilled everywhere. The neck area, awesome for this. So you can see, like on the upper left, actually the top, they don't need Kybella, they're just saggy. So that's just taking their neck and lifting it. But That's without surgery, so that's pretty awesome. Down below, the bottom right one's really good. It's after 180 days.
So you just wait on it?
Yes. Patience is key. That's why I always take, good before pictures, because it is hard to look at yourself every day in the mirror and say, okay, whoa, I look really different from one day to the next. I mean, to you, you're gonna look similar. You're gonna notice something, just kind of like if you haven't seen somebody in a while and you've lost 30, 40 pounds, if you really need to lose weight, they're really gonna notice. You might be like, oh, this is not that big of a deal, so. Or 10 pounds, if someone's not seen you in a while, you're gonna look way different. And they're gonna say something and you're gonna be like, well, it's, 10 pounds, but I don't feel like I look that different, so. That's what I like about this. Because people will notice, no one's gonna know what you've had done. A lot of times when you see filler, and you see, like a facelift, you're like, whoa, what have you done? Looks good, but you can tell you got something done. So the décolletage area is awesome. We normally skip this when we do our, skin regimen. I know I have a problem of, I wish I put more sunscreen on this area growing up, because this to me is most likely just to get burned. I mean, especially if you're outdoors a lot, doing sports, whatnot, and this gets crepey. You can see age from here down. That's just how it is. So this is going to build collagen around this area, and it's going to help with those fine lines and the wrinkles around where you're, so you can wear your V-neck shirts again. You can feel comfortable. If you do something to your face and then your neck's, looking a little older, you're gonna kind of wonder what you've been doing. So here's some examples. Just so you got that crepiness, and peels help with that. I do like neck peels and stuff, but this is really gonna target underneath. And what you would do with this, is if you wanted to keep this up is, I would say come back and we'll do like a neck peel every 6 months or whatever, just to kind of keep that dead skin off, keep it fresh. But that really does a whole lot, in my opinion. So.
Is this helping with the age spots?
No, I'm not gonna lie, it's not gonna help a ton with age spots. It's just more for lifting, and tightening. So, the erbium yak would be a great thing to do after this is done. If you've got both, problems you wanna correct, or it doesn't really matter what you do before and after. They're targeting just different depths. So this is gonna be more towards the muscle, and then the erbium is gonna be more superficial. So it's gonna help with those fine lines and dark spots. Like I said, the beauty of this is there's no downtime. I mean, I don't like downtime. Even a day or two is annoying to me. So this is just an awesome option. If you're gonna be active, doing something, you can get out in the sun. You can literally do whatever you want right afterwards. So. What I do when I do a treatment is I mark the area, like where to go on and whatnot. So those areas that you don't need to go on are marked out. So that just kind of shows me where I'm going. And it shows you where I'm going to. So that's what takes kind of a longer process pretty much, is the marking, and we treat at multiple depths, so that also is, more time consuming, but like I said, it's not gonna be more than 2 hours every time. And going under the knife's gonna take a lot more than that. So this kind of shows you, after 1 week, you're gonna notice tightening, plumping, your lines are gonna be kind of filled in. You're just gonna notice your face is gonna just feel better. You might have some redness, but from what I've seen with patients, it's pretty much the day of. I haven't seen anybody come back the next day and be super red. So right here, the décolletage, you could have some swelling. Most people like that. So, I mean, that's not necessarily a bad thing. So you're just gonna kind of continue to see a tightening lifting as the weeks and, you know, months go on. So, does anybody have any questions?
And is this popular with men?
Yes, very,
Med
because,
clients?
oh yeah, because men don't obviously like to, people know they've had anything done, and they like that jaw area to be, you know, defined, so this is an awesome option for men.
Okay.
Because guys really don't have the time to, you know, peel for a week and, you know, be super red and then explain to their friends over a beer, you know, how they had their treatment done, you know, and it just, yeah, it's just girly, I guess. But this, they don't have to say anything, no one's gonna notice anything except for, wow, he looks super manly.
Gradually.
Yeah, gradually, they're just gonna, you know, form into a better version of their manly selves. So yeah, there are some risks, but you know, it's very minimal. But just if you follow our before and after precautions, you're gonna be just fine. So this kind of shows you see build lift. The biggest thing about Ultherapy is the visualization that we have, and we can see where we need to target. We can see where you've lost volume, and literally go right in there and do the ultrasound and deliver those lines. So that's the kind of the coolest thing about it, besides no downtime. Over 95% of patients are satisfied. Who wouldn't be with absolutely no downtime and just a better looking you in a couple months. So yeah, that's all I've got. Thank you for listening. Is there any questions?
How often do you repeat this process?
No, it's a one-time thing, but you do want to follow up, like I said, with like you know, peels. You want to keep taking care of your skin, but with how like in depth this goes, you don't need more than one. So, but like I said, like if you want to do multiple treatments, like you want to start with up here first, like your brow, and then you want to go right here, and then you want to go down here. So that would be like your multiple treatments, but yeah, it's pretty much a one and done thing, which is really cool. Any other questions? I thank you for coming, and you'll be in a drawing for a free laser treatment. So thank you, God bless, have a good night.
Thank you. Good job.